Looking at the major veins of systemic circulation, kind of moving downward, we have veins that drain the upper limb, but then we have the right external jugular vein here. This is, again, draining the superficial head and neck, and it drains it into the right subclavian vein. We then have our oh yeah. On the left-hand side, we'll have the left external jugular vein 'cause it's going to drain similarly to the right brachiocephalic. We also have the right vertebral and left vertebral veins. These are cervical, spinal cord, and vertebra drainers. And then we have our intracranial dural venous sinuses that drain into the right internal jugular vein. And then all of these are going to kind of meet together and they're going to drain into the right brachiocephalic, which again, the left looks just like the same, less same as right and left. And both the right and left brachiocephalus drain into the superior vena cava, which then drains into the right atrium of the heart. Most veins of the brain drain into the venous dural sinuses. There's a superior and inferior sagittal sinus, a straight sinus, a transverse sinus, and a cavernous sinus. And you can see all of these listed essentially here on this image. Most sinuses will drain into then the paired sigmoid sinuses at the base of the brain, which then become the internal jugular veins, both right and left, which they get the majority of the blood from the brain itself. The internal jugular veins will join at the subclavian veins at the base of the neck to form the brachiocephalic veins. The external jugular veins drain more of the superficial scalp and face structure, and they drain into the subclavian veins also at the base of the neck. And then the vertebral drains pretty much drain very little blood from the brain. They're mainly serving the cervical vertebra and spinal cord, and they join the subclavian vein at the neck near the external jugular veins.